So let's quickly look at a bone fragment displacement. So if there's a bone fragment displacement, how would it actually look like on imaging? So here is just more of like we're just trying to, fascinate ourselves, look around, how some other things will look like, on a particular, So let's quickly look at what this is and what it means. Okay, so bone fragment displacement in radiography. Let's quickly look at what it is. We said that just refers to how pieces of bone, they move out of their normal position. So where they are aligned, they move out of where they are aligned. Okay. Mainly this is after a fracture. So after a fracture has occurred, everything is just scattering. So types of displacement seen on radiographs include translation, okay, where the bone fragment moves sideways relative to where they normally should be. So this one, to say that it's translated, it moved to the side. Okay, moved to the side. Move to the side. So rotation, okay, angulation, the bone fragment tilts. So this one is not moving away, but it kind of like causes some abnormal angulations. Causes abnormal angulations. Then we have rotation, where the fragment tilts. Tilts. So shortening and overlapping, and also destruction, where the fragments are pulled apart, increasing the gap between them. Okay, so you see this. So radiographic assessment is if you are accessing anything that has to do with, fractures, bone fragments, scatterings and all of that, you always try to look at the anterior posterior view, that's from the front to back. Also lateral views, they are very important for you to now make a wholesome diagnosis. So oblique views may also be added if the fracture line is not clearly visible. So radiographers must also ensure proper positioning to avoid misinterpretation due to projection errors. Okay, the radiologists describe displacement in terms of direction and degree. So you have a distal fragment displaced laterally by 5 mm, angulated 20 degrees, and a whole lot of language that are used there. So clinical importance is minor displacement may be managed conservatively, while there's significant displacement, you now have all the surgical modalities coming in, internal fixation, external fixations, and the rest of it. Okay, but by and large, the imagings help us to now confirm that there was a displacement and make the right diagnosis.